participate to make a statement under Rule 55 so that I can also discuss and also make a statement on the surge of dengue in the state. Thank you, Speaker Sir. With your permission, let me say a few sentences for the awareness of all the honorable members. And I thank my friend, Honorable MLA Achumbemo, for initiating this important discussion. And I thank him for bringing this very relevant issue in this August House today. The Speaker Sir, I believe in the discipline of work more, talk less. But today my colleague is pushing me to the corner for me to speak. So I shall speak few sentences with your permission, sir. Speaker Sir, yesterday while I was watching WhatsApp chats, I have seen many intellectuals criticizing that Nagamis is meant only for the Konyak legislatures in this August House. And this has awoken my mind to say that the honorable members from here, from the eastern and also from the Konyak legislatures in this August House, are first generation of the educated people, and including me, because the church and education came to my village only in the year 1965. And that also, we were taught in education as well as the Bible, we were taught in our dialect. So today, if you had presided the assembly in our dialect, I think most of the Konyak honorable MLAs would have been very super fluent in the language. Sir, when you watch participating the honorable Konyak MLAs in Nagamis, I wish that those intellectuals who are participating, who are chattings in the WhatsApp group, should remember that your great-grandfathers and your grandfathers were also like us today. And I know that what we are today is what they were yesterday. And so when any one of the intellectuals or learned mocked at us and laughed at us, they should also remember that they are laughing at their own grandfathers and great-grandfathers. But today, I want to say that, and I proudly say that, the honorable member from the Konyak community, Mr. Sri Baba Nyemnyai, he has a son as a joint residential commissioner in Delhi. And also the honorable MLA Sir John, he has a son as a doctor. So as I've said, maybe our honorable members might be speaking in Nagamis because we are of the first generation of educated people. Anyway, Speaker Sir, like my friends and seniors, thus, let me also mumble few English sentences to satisfy the WhatsApp participants. As I used to always say that I don't have any issues and I never have issues. But since our honorable member have raised the issue and requires an important discussion, with your permission, I would like to make few statements here of what the department has been doing and what the department intends to do in the days to come. So in case of any outbreak of sickness like endemic or a larger scale where more attentions were required, the Department of Health and Family Welfare considers as an emergency and fast-track necessary arrangements are carried out in observing certain protocols and mechanisms. First mechanism is, sir, as soon as we get the first information report, that immediately Victor-born officers are alerted and deployed and put into action to ascertain the facts and factual causes of the sickness. Second, if the sickness is of huge magnitude, then the department first deploys additional manpower, redeploying from within the district, and then later on, the rapid action team are also sent to the locations. Likewise, sir, in the district of Mon, Dimapur, and also in Bandari, all the above mechanisms were observed and everything is under control as of now. Sir, another most important demand made by the people, made by the citizens is fogging. And fogging has been done in Dimapur. Even our honorable advisor, Toby Hoto sir, has physically been active in fogging the Dimapur town, as well as in Mon. And the public demand fogging, but the department preferred sanitation and cleanliness drive more than fogging, and keeping the surrounding dry and clean. And it will not allow mosquito to lay the larva, because even if we kill the mother mosquitoes by fogging, we still have not killed the larva which hatches the mosquito. And besides, fogging is done by chemicals and petrol. And if that can kill mosquitoes, definitely it will also harm human lives, although we are 1,000 times larger than a mosquito. And sir, during my inspection, I have also realized that many districts do not have a district health society meeting, and are suggested for frequent meetings of district health society, where DC of every district is a chairman, and CMO and MS are the members and secretary. And it also comprises of tribal bodies, and any big health issues in the district has to be deliberated in that meeting, and further, if necessary, it can be taken up in the DPDB, where the honorable members are also made to be aware. And sir, in this regard, I'm happy to know that many deputy commissioners, especially from Dimapur and Mon, have issued directives for sanitation and cleanliness drive within the wards and colony on weekly basis. Sir, I'm delighted to inform you that yesterday, the Honorable President of India has launched Ayushman Bhav at the national level and in the state level by the Honorable Governor in the presence of our Honorable Chief Minister, where it emphasizes on social works, on sanitation and cleanliness drive in the towns and villages. Sir, dengue is caused by Aedes aegypti mosquito. It is also known as tiger mosquitoes because of the patches, black and white patches which they have in their body. And this aegypti mosquitoes usually roams in the morning, and below the knee it walks, it roams. And sir, when the people comes to the hospital with a severe headache and vomiting, then they are tested with rapid diagnostic test and later by the confirmatory test called ELISA test to examine whether the patients have dengue or any other vector-borne diseases like Japanese encephalitis. When the patient have dengue, sir, then there is no specific medicine for dengue, except fluid intake must be maintained, and so the health workers, we administer IV fluid, and symptomatic medicines are provided, like for headache and for temperature. And suppose if the platelet goes very low, below 25,000 or more, or bleeding starts, then the white blood will have to be transfused into the patient to increase the white blood. But blood cannot be transfused unnecessarily. This time when I visited the district hospital Dimapur, during my routine duty, I observed huge queue for the blood donations. For their relatives And yes, it is good to donate blood for the relatives, but we should also keep in mind that we have to donate blood for everybody, for every Naga. The blood which has been taken out from a healthy person is segregated. The plasma is extracted. The protein of the blood is extracted and made as a white blood in order to give to the patient who has a low platelet count. The normal platelet count of an average person is 150,000 to 450,000 for microliter of blood. But in case if a patient with a dengue symptom or with a dengue as confirmed by the ELISA test is found that his platelet has dropped from 150,000 to 450,000 to below 25,000 and bleeding starts, then that is the moment where we have to transfuse white blood. In case of patient with low platelet from far districts, can transfer the patients to the Dimapur District Hospital or to Nimsa Teaching Hospital, as well known as NHAK, where the plasma segregations are possible and can provide the white blood transfusion. So these are the only two health centers, hospitals, where this white blood segregations is possible. Therefore, any serious patients from other districts and subdivisions suffering from a dengue with low platelet count, then they should be immediately transferred to these two hospitals. And the department is taking every steps to provide the blood. On noticing a surge of dengue in Mon district, I immediately rushed to the district with my team on 21st of August and took everything under control. So we discovered that the surge of dengue was mainly due to the unceasing rainfall with lots of stagnant waters available for the mosquitoes to breed, and the drains were blocked and waste were not properly managed. Therefore, it is important to keep our surrounding clean and dry. And as for the conjunctivitis, now the viral has subsided and everything is normal by the grace of Almighty God. And so on this line, the department has published do's and don'ts to sensitize the public, and even up to the lowest grassroots level, the villagers, the health workers are educating and providing awareness to the public. About the present situation of surge of dengue disease in Mon and Dimapur and Bandri, the department is closely monitoring and doing everything possible to help the patients, although there is no specific medicine for dengue. At present, there are 136 patients admitted in district hospital at Mon with 50 dengue positive through rapid diagnostic test and confirmed through ELISA test. And others are negative, yet it is dengue-like sickness, but so far no death. To my surprise, sir, when the public realized that there are no proper medicine available for dengue, the people get terrified and panic and flock to the hospital if they have slight dengue-like symptoms and they prefer to stay in the hospital. I had updated yesterday from the MS, CMO and BC Mon. And the MS and CMO of Mon district has asked for more manpower and additional fund. So the department is working on it to be sent at the earliest possible. And as for Dimapur district, I visited on 2nd September, and the case of dengue are at present 80 patients occupied in bed till yesterday and gradually declining according to the record of Dimapur District Hospital. And as for the private health centers, I hope the numbers are also declining. I repeat that, sir, as for the surge in dengue, the department is taking every steps to provide the best health services to the public. I also appeal to the citizens in this August house to keep our surroundings clean and free from stagnant water so as to keep away from the tiger mosquitoes. I also request the district administration and district health societies to sensitize the public and issues directive for mass cleanliness drive in the colony and wards. I also humbly request the doctors, nurses and the lab technicians to continuously provide extra services till our people are rescued from this dengue and other waterborne diseases. Sir, it is too early to appreciate, but I want to salute those doctors and health workers of Mon and Dimapur District Hospital for extra service that they rendered towards the people, even by monitoring at late night and those working at blood bank. And lastly, the participation of the citizens are important to destroy the source of dengue, and the doctors and the nurses and lab technicians to take care of the patients, and the district health society to play the supervisory role. And when these three organs come together, then I can assure you that the Aedes aegypti mosquitoes will have no place in our state. And the Directorate of Health and Family Welfare is acting like a war room, monitoring everything and supply with whatever is required, are time-bound and putting all officers on alert and ready for any action in the ground for the service of the citizens. And lastly, but most importantly, I pray to Almighty God to keep the citizens of Nagaland safe from dengue or any other vector-borne diseases. Thank you, Mr. Speaker.
I have moved about the issue to discuss on the searching of dengue and conjunctivitis. This is of urgent public importance, which I thought. But before I go into it, Honorable Speaker Sir, I must put on record my highest appreciation to Honorable CM and the Honorable Minister in charge of Health and Family Welfare for starting the medical college with effect from 1st of September, I guess, 1st of September. Of course, the official inauguration is still awaited, but the course have been started as committed to the people of Nagaland. We have already started that medical college. I must put my highest appreciation to the Honorable CM as well as the Honorable Minister in charge of Health and Family Welfare. Well, I also would like to appreciate the Honorable Minister, Mr. Paiwang, for his generosity in donating some important items which are required in the medical hospital in district hospital in Dimapur. That was a very kind gesture on his part. For I have gone through some of the paper where it was reported that he has donated. The minister also assured he would personally donate personally. I hope it is from his own money. We are very grateful to him. Donate medical equipment such as endoscopy and laparoscopy sets, video processor, gastroscope, colonoscope equipment, medical grade monitor, etc. Both rupees 66.50 lakh. I think I would like to appreciate him for taking such a personal initiative in upgrading the district hospital in Dimapur. Well, he has also announced that it will be a referral hospital. This is a welcome step. I think the state is under pressure because we have one state-of-the-art hospital only in Nagaland, that is the Naga Hospital, Kohima. But now it will be also under intense pressure because of the opening of the medical college where the practical courses will be held there. I was also informed that in the Naga Hospital, Kohima, there is inverter only in the ICU and operation theater. In the common ward, this general ward, there is no facilities. So as and when the light goes off, people use mobile to even refer some medicines, do some injection, which is, I think the department, I would like to suggest that those things need to be taken care. And as far as the rise of dengue is concerned, Honorable Speaker Sir, my constituency, Pandari, is one constituency where it is very highly affected because it is situated at the foothill areas. Mostly the dengue is disease dengue infection is mostly in the foothill areas. And our Honorable Minister in charge of Health and Family Welfare is also from foothill area. He hails from his home. Visit, he will know better. I would like to suggest that a prompt initiative be taken where proper medicine be supplied. I remember there were a lot of shortage of medical kit in testing, and since the officials have approached me, I have also extended a little bit of what I could in my constituency. And while saying so, Honorable Speaker Sir, I also would like to request you to kindly see that enhancement of our salary also, so that we could help our constituency, because whatever is any kind of problem, these days the public only demand from the elected members. MLA berhati bolage, MLA ke bolage, shop MLA ke to. As of now, our salary is only 50,000. I think public should know this. I would also like to say this, because without all this, with that meager amount, how can we serve our people? In fact, it may be out of context, but in terms of status, the elected members are supposed to be above the status of Chief Secretary, in fact, Honorable Speaker said. But when it comes to the salary, we are actually at the rank of maybe lower divisional assistant, which I feel that the Honorable Speaker may like to take note of it, because we also would like to serve our people, and with our own, as far as with our own little income that we get even from our salary. This is what I would like to put across. Now, on this issue, we have also come across the school closing down, and notice served by Deputy Commissioner Dimapur, where schools have to be forcibly closed down because of the surging of conjunctivitis. And not only dengue case, I think dengue case is more in Dimapur and in some of the foothill areas. And therefore, this department may like to take note of it and take urgent attention, because we have experienced during the last 2019-20 about the COVID experiences, where we had a very bitter experience. We lost quite a lot of life. Many have been hospitalized. I think the medical department has to gear up. The health issue is first come first. The rest comes next, and therefore the department has to. I know that they are trying hard, but more effort needs to be done. In my area, when I checked up in Primary Health Center Bapti, there is no doctor, Honorable Speaker said. When I inquired, the doctor who was posted is on study leave from 2023 to 2026. So unless the study leave is completed, it seems she will not come back. So for the past three years, that PAC Bhakti will not have a doctor. I think the department need to examine this procedures. If there is a provision to send a doctor for a study leave, there has to be an alternative where a substitute needs to be appointed, or the other way around could be that half of his salary may be deducted and somebody may be appointed on contract till he or she returns from our further studies. Unless these alternative arrangements are made, we are left with helpless. Who will guarantee us that for the past remaining 3 years, unless your doctor returns, there will be no fever, no date? I think these are a few things which the department has to rectify in its system. I was running around in the department, in the secretariat. They were also informing me that there's a lot of acute shortage of manpower, including doctors, nurses, and other staffs. I would also like to suggest to Honorable CM and Honorable Minister in charge of Health and Family Welfare that we should focus more on creating posts if necessary on the health workers, including doctors, nurses, and other staff related to that. I think these steps needs to be taken. There is a blanket ban on post creation. I'm fully aware of that, but I think this issue needs to be addressed very urgently, because unless there is a sufficient manpower, we also cannot keep always blaming the government that there is no doctor, there is no nurse in our area in Nagaland. I think this they will get disturbed too much. I mean, if we keep telling them like that. So I think a proper policy is required to increase the number of manpower and see that the posting is done. I was also informed that there is no chief medical officers in the new district created like Zeminyu, Shamador, Newland, Achumbemo, so on and so forth. I think more manpower is required to tackle because we never know. We will not, hopefully, such thing will not recur again, but a COVID-like situation, or if not, worse may come again. So we need full preparedness on the health sector. Yesterday I attended one program at Rajbhavan where Ayushman Bhava was launched by the President of India. Honorable CM was there launching in the launching program, and our other Deputy CM and other cabinet colleagues. So that was also a good initiative. Lots of initiatives are going on, I'm fully aware, but more needs to be done on the health sector. This is what I would like to put across through you to the August House and to our Honorable CM and Honorable Minister in charge of Health and Family Welfare. Thank you very much, Speaker.